Anyone who's trying to suggest that structural racism is a thing of the past clearly has not looked at the evidence. Things that happened centuries ago have a legacy that we're still seeing today. In many areas, it's actually getting worse. My name is Dr. Michael Siegel. I am a professor in the Department of Public Health and Community Medicine here at the Tufts University School of Medicine. The research that I'm doing now focuses on racial disparities in health. Racial health disparities are the legacy of many, many decades of racial segregation. The conditions within racially segregated areas tend to be much worse. And because they are viewed as Black neighborhoods, they tend to get less funding from the government. And sadly, people of color are dying prematurely way, way before the life expectancy. Racial health disparities are not acceptable. It is public policy that has got us into this situation. And it's public policy that's really the only way that we can get out of this situation. What's shocked me is very few articles looked at structural risk factors for disease. That's never been looked at before in the literature. What we set out to do was look at changes in racial segregation over time to see whether those changes result in changes in racial health disparities, to see whether there was a connection. If we can understand whether changing racial segregation patterns will actually change the trajectory of health disparities over time, that can provide proof of concept that this is an intervention that will ultimately result in positive change.
Previous research has shown that segregation does have an impact on racial health disparities, but previous research hadn't really shown the relationship between trends in the two. We looked at disparities in metropolitan areas between 1980 to 2000. Group 1 had the lowest level of baseline segregation, Group 2 was the mid-level one, and then Group 3 had the highest level of segregation at baseline.
We found strong evidence that changes in segregation from 1980 to 2000 strongly correlated with the change in racial health disparities from 2000 to 2020. So in other words, if racial segregation went up, we saw a rising trajectory of racial health disparities, and vice versa was also true. If racial segregation went down, we saw decreasing racial health disparities.
What that ultimately means is that segregation and changes in it is statistically significant in predicting the likelihood of changes in racial health mortality disparities over time. There's definitely a correlation.
The findings of this paper are quite sobering. In our society, we tend to blame health problems on the individual, and we attribute it to people's character, when in reality, what this research is strongly showing is that health disparities is structural.
We used the linear trends to predict when this disparity doesn't exist for each trajectory group. Group 1 was the soonest, it was 2034. Group 2 was 2075. Group 3 was projected to only get worse over time.
This third group is never going to see an end to those racial health disparities. I mean, if anything, we're going to see an increase. This type of research that identifies danger zones in this bad trajectory, and it allows us to target those communities as priorities for intervention.
Interventions in public health are based on research, but it never really means anything unless you use it in a meaningful way.
It's really time to push the envelope and to start studying communities as the basic unit and to look at structural factors, and that it's done in a way that protects populations of color. The burden needs to shift from the individuals who are suffering to the people who have the power and implement anti-racist policies that reverse the impact of decades and even centuries of structural racism.
Our research is proof that addressing segregation may be an effective means to reducing racial mortality disparities in the U.S. We're hoping to bring this information to more people and let it be the basis of future research. I'm excited to see what people will come up with.
This could not have been done without these student researchers. What we're trying to do at the end of the day is change the world. You know, that's what public health is all about. That's what I'm trying to do with students. They can change the world. I feel that's important for me to provide them with the skills that empower them to do just that.